Welcome to the Right Tack, where we help private practice owners face the headwinds of the healthcare industry. I'm Paul Jonas, CEO and co-founder of Breezy Billing and Phoenix Credentialing.
And I'm Jim Jonas, therapist, co-founder of Breezy Billing and Phoenix Credentialing, and the founder of the Jonas Center.
Today, we're kicking off a two-part series focused on a question every provider has to ask themselves at some point. Where am I going to work from?
Well, yeah, and you can take a look at, people who are just getting started versus expanding your practice, choosing, what kind of space to work in, whether it's a virtual space or a co-working space, a traditional lease, a buying some of the, a suite. It makes a huge difference for your budget. And it kind of depends, I think, on your personality and how you want your clients to experience your space.
To help us unpack the very real challenges of finding space for your private practice, we're joined by Dr. Talha Baloch. He's a general and addiction psychiatrist who is board certified in general psychiatry, addiction psychiatry, and addiction medicine. He's also the founder of Comprehensive Psych Solutions and co-founder of Mindful Spaces, a co-working and office share community just for mental health and healing professionals.
Let's dive in.
Let's dive in.
All right. Usually, Tala, we like to take a few minutes to get an idea of, what you do in your off time when you're not doing your work and, what your plans are. And we always like to ask people, well, what your plans are for the weekend.
Yeah, well, thank you guys so much for having me. It's, really nice to see you guys, Paul. Always a pleasure. I know we just saw each other yesterday. That was a really good kind of introduction to what we're doing here today. And Jim, great seeing you again. I'm really excited for today's opportunity. And I know you guys are going to get a kick out of this. I'm actually going out on Lake Minnetonka on a boat this weekend.
Nice.
It's not a sailboat, so I do apologize for that. It's a pontoon, but we're really excited to being out on the water, just to, slow down and recharge a bit. So we're really looking forward to that before next weekend when I'm on call all weekend. So you got to take advantage of the weekends you have.
Absolutely. Are you renting something, or do you guys have a pontoon that you'd like to take out?
No, we're just renting at the moment. My wife believes you don't buy anything that floats or flies. So right now, I'm working on convincing her to change that, because one day a boat and maybe a Cessna might be in the picture.
Oh man, I'm right with you there. We could split it. That's right in line with where I want to go too. Although I hear the two happiest days of a person's life is the day they buy their boat and then the day they sell it. So I don't know.
Okay.
I've heard that as well. So, I like the renting option for now.
Nice. That sounds great. That sounds awesome. How about you, Dad? What do you got going on?
Oh, this weekend.
And we're doing a little podcast time magic right now too.
We are,
because this is our second episode we've recorded in the same week, and it's my fault. We've been busy. Yeah.
So I don't think people know that I'm going to be weed whacking this weekend. It's one of my favorite pastimes.
Oh. It is. It's like 4 hours of just
4 hours of
buzzing
weed whacking. That's what I have to look forward to. And what else might I be doing? Doing a little mowing, but the weed whacking. We want to get that ready. Weeds are something. My wife, is gardening. She spent 2 full days in the garden weeding, with all kinds of spray on her and stuff. It's amazing.
The bug spray.
Bug spray.
Yeah. Well, and it's fun seeing Mom when she's done weeding. She's black. Her hands are black. Her knees are black.
Yeah.
And I don't. We mentioned you guys have a hobby farm, right? We've talked about the solar panels almost every episode.
Oh, yeah.
I think we actually forgot last episode.
Oh my gosh! I just got the check.
Awesome.
We put a bunch of solar panels on a couple of roofs, and we're actually Excel is actually paying us even after we use the electric that we use for our household. It's great.
And
that's amazing.
So for anyone who's tuning into this show, if you heard our last show, this coming weekend I'm leaving on a 9-day hike with the scouts with my son, and I think Tal, I think I mentioned this at your networking event last night, which was fantastic. Thanks so much for hosting that. That was really cool to see, and to see some of the people that came out for that. Yeah, so going on this 9 day hike, no cell service, nothing. So I've realized, since you already know about that, everybody who's following our podcast very closely, I'll tell you what I'm doing the following weekend while still just getting into cell service. I will be putting on, I think, deodorant for the first time in
Oh,
8 or 9 days.
that'll be good.
And so will hopefully everybody else in our crew. There's 9 of us going. And it's going to be pretty exciting to do that. So hopefully we'll be talking about coming down the mountain and how great the trip was and probably, fixing blisters and things too.
Good. Great.
That sounds like a lot of fun. Yeah, I hope you enjoy that.
Yeah.
Thanks. We'll see. I'll let you know, next weekend. Um,
And Jem, you reminded me I got to mow the lawn as well, which I'm not looking forward to.
Okay. Now, do you have a riding mower?
I don't. I have a generic push,
Okay.
mower.
Oh,
Yeah.
my
Mhm.
wife and I, we each have our riding mowers because we have a pretty big lawn, and it's kind of fun doing it together. So,
that is cool. Yeah, the dueling
Get to race up
lawnmowers.
and down.
Yeah.
yeah, yeah. So, oh, what do you think?
Well, thanks for being with us today. So before we dig into this co-working side of things, welcome to the show. We're excited to have you. Could you kick us off with a quick introduction about yourself, and how you got started with Comprehensive Psych Solutions?
Yeah, absolutely. Just a little bit about myself. I got into psychiatry many years ago, just kind of seeing the need that there is for mental health support in the world right now. And just with the opioid epidemic and everything else, alcoholism, addiction psychiatry really kind of became a passion of mine. So decided to pursue certifications in both and realize that, with addiction psychiatry, there's a lot of medication and medicine components to it. So went and did my addiction medicine boards as well. So tried to get really involved in that. And, I initially started off after graduation working for a lot of private equity backed practices. And over time, I got really burnt out by the limitations that they, put in place on patient care. The focus was just so much on profit, and that came at the expense of providers and patients a lot of the time. So I personally wasn't able to spend that kind of time that I thought was important to give my patients to offer quality care. So going out on my own is what really allowed me to set a pace that prioritized one, my patient's needs, but also myself, give time to my family, and then be reimbursed appropriately for the work I do. So started Comprehensive Psych Solutions with the idea that we take a comprehensive approach and find solutions to mental health care. So not only medication, but therapy and looking at lab work. And that's where the idea came from. And we've kind of grown from there.
Okay, I'm sitting here thinking, and in our previous podcast too, it's like people that we're interviewing, and I think the people that we are too, it's really relationship based, and not doing the cookie cutter thing, and just having your own, being your own boss, I want to say too, and making it humane, and that's what I'm hearing from you, Talha. So yeah, great.
That's that actually struck me too. That when as you're introducing yourself a bit there, Tala, it was we really get along well with people who don't want to do that cookie cutter, money making mental health support or behavioral health support. And it's cool to have, you as part of that, and I can see why we got along so well when we first met, and that's led to where we are today.
Yeah. Well,
Absolutely. I mean, just listening to some of your other episodes and talking about being independent and being supportive of your colleagues, I think that's what really draws us to the work that we do. And our conversations are always pretty great because we really touch on that almost every time we connect.
Yeah, cool. Yeah. Well, so you're seeing clients virtually across 4 states right now. I'm California, Illinois, Minnesota, and Ohio, and then also in person here in Eden Prairie at the office here in Eden Prairie. That's pretty amazing and ambitious, I think so, and impressive. So, but I get one of the questions here is like, what were some of your biggest challenges when first getting this set up, the multiple places and environments.
Well, I honestly didn't even think I would open up a practice that offered multiple states. It all just kind of happened naturally in a sense. I trained in Illinois for my residency, so I had an Illinois license. And then I went to Ohio for my fellowship, maintained that license. And then I thought I would go work in California, got that license in anticipation. Ended up not going there and moved to Minnesota with my wife and got a Minnesota license. And I said, well, I've already paid for these. Let's take advantage of it and, open it up to these states. But the logistics, oh, what a hurdle they were. I mean, everything from licensing to credentialing, navigating the state regulations, making sure that the infrastructure was appropriate. And I mean, I think the biggest challenge was just finding out what the needs of each insurance panel were, having an address, having a place for in-person and a mailing address, and all of that really took a lot of time to weed out and really understand. So that really took a lot of time to navigate. And I think, yeah, that address, that space, the credentialing aspect of it was probably the hardest part.
Well, I'm thinking, and I definitely want to jump into the co-working space and getting into that and like where that came from. But just in a future episode, it'd be great to have you on just to talk about psychiatry, medication management too. Once we get through this kind of this practice building series that we're doing.
Absolutely. I'd love to chat about that. I mean, I think there's a place for medication, there's a place for therapy, there's a place for more holistic care. And I think if we are able to navigate all of those aspects, we can provide appropriate care to the folks who come seeking it.
Awesome. Yeah, definitely. And boy, is it needed.
So I've got, I mean, one question that's not on any script or anything.
Oh, yeah.
Hey.
We're already tangent.
Here we go. But how much of the credentialing and the location and all that kind of stuff did you do on your own versus do you have someone, who really takes care of all that stuff? Because, as a agency owner here too, it can be a nightmare keeping all that stuff straight and up to date.
Oh, absolutely. And, Paul heard me talk about this yesterday at the networking event where I admitted that I did a lot of this on my own and I made a lot of mistakes along the way and I paid the price for it. And one of the biggest things I shared with the individuals who came to the event yesterday was use a professional. And once I started using a professional, things got so much easier. So knowing what the logistics are, knowing what's required, they don't teach you that in school. And if you are seeing patients all day, you don't have the time to go into the weeds and read about all the requirements. So folks like yourself really help us do things right and make sure we follow all the rules.
Cool. Okay.
So let's get into the core of today's topic. Finding space for your practice. And when you first started, I guess when you first started, what kind of physical space did you use? And then tell us how that translated into, how you got to where you are today with Mindful Spaces.
Yeah, and this kind of piggybacks to that last question there about, do I have a professional who helps me with this? And like I said, I did it all on my own and I didn't know better. So I set up a home office. I used my home address for everything. And I learned the hard way that now my home address is out there in the wild for everybody to see. And after recognizing that mistake, I was like, all right, well, I need to figure out what to do about this. And I found a co-working space in the Chicagoland area that was designed for mental health workers. And I joined there. I got a virtual address and I got to see people in person and do my virtual work without having to have my home address on the line any longer. But yeah, I started off at a home office.
Okay. Huh. Well, okay. So you're mentioning the co-working space in Illinois where you started. I'm already hearing some relief, to not have your home office, your home address out there, those kinds of things. Anything else about, finding that and why it worked for you at the time?
Absolutely. I wasn't sure the direction I was going to go with my private practice. And I just wanted to find something that met me where I was at that moment. I was just starting out. didn't have a full caseload. I needed something that I could grow into, and having access to a space without being locked into a full lease was really helpful. And it gave me the room to scale without overcommitting financially. And that was one of the key aspects of finding this place. And not only that, they really offered a community. So I want to give a shout out to the Estuary Center in Naperville, Illinois. That's the place where I rented a few hours every Friday afternoon, and they had great space, multiple amazing practitioners, and I was able to create a network of referrals for folks as well. And even now that I'm no longer in Illinois, I still rent the address there, and I still get referrals from that community who really got to know me and know my work. And so they think of me whenever they need someone for medication management. So not only was it helpful for me at that time when I was living there, but still till this day, having that address and that connection is really important for me.
Okay. I when I think back when I first started in private practice, that was the biggest, scariest thing I was doing is, renting office space. And, I didn't do the co-work kind of thing. And that sounds like a real nice stepping stone to get in. So that's good. That's great. Yeah.
Absolutely. Yeah. When you're not making any money, you don't want to, put 80% of your monthly income into rent. And,
Yeah.
If you can find an alternative, why not?
Yeah.
Yeah. And I love that about co-working spaces and virtual offices that have popped up. I know it was kind of a thing before COVID, but that really accelerated the idea that you didn't have to have a full-time physical office to go to or to find someone to sublease from, and deal with some of the complications that come with that. So now that you're running mindful spaces here in Minnesota, what are some of the differences between this co-working model and a traditional lease model from your perspective as well, as a provider and as a business owner?
Yeah, absolutely. When I was looking for a place to open up an in-person office here, I explored all the options as well, whether it was getting a full office, whether it was subleasing from someone, and I realized that I just needed another space like I had in the Chicagoland area, and I didn't really find that here. And so we created Mindful Spaces. Earlier this year, we opened, and we have 6 fully furnished offices, a group therapy room, and a flex space for massage and acupuncture. And we have a receptionist with full stock beverage and snack bar and mailbox services. So I created something that I knew I needed, and I realized other professionals needed as well. And when I was looking at the alternatives of a traditional lease, signing on to a long-term expensive commitment that you're on the hook for, everything from furnishing, hiring the staff, coordinating internet, security, utilities, you name it. There's just so much that goes into that, and the overhead is pretty drastic. So when we created Mindful Spaces, I was like, hey, let me create this. I will manage this part so other professionals don't have to worry about that as they get their start. So we're able to offer a lot of that. And I looked at other co-working spaces at the time as well. And a lot of them are very corporate based. I'm sure you guys have seen some of the big players in the co-working space. And the thing is, they don't keep things like HIPAA in mind. They don't really make it therapists, mental health, healthcare accessible. And so making sure that we created a space that offers all the important things to make it feel like a clinic really was the vision for Mindful Spaces.
Okay. Well, okay. So for providers who don't need a full-time office space, can you talk a little bit about the virtual office setup, and how does that factor in? And what about having a virtual address, and still having a legitimate practice that's there?
Yeah, a virtual address and a virtual office go a long way to legitimize your practice. And that's something we kept in mind where having a professional address that you can use for credentialing, for insurance panels, for marketing,
Mhm.
for even like Google address. They're very strict on what um, an address entails, and they want to make sure that it's legitimate. And not only that, the DEA for prescribing practitioners, they want a physical address if you're going to be prescribing controlled substances that they can come and do audits at. And so just having a basic virtual address that doesn't have a space theoretically can help you have an address, but it doesn't help with any sort of like audits that may occur. So a virtual address where you have access to an office is really important. So that way, even if you're not there full time, you can rent an hour a week, 2 hours a week, whatever is necessary, and still be legitimate. So you are coming there in person, you are seeing people, and it makes it all the more professional as well.
So you've really built something intentionally for mental health professionals, is what I'm hearing. And I know, well, one of the stories I've told before and we've experienced is we've had customers get site audits, and so that one more recently, it was at a co-working space that was not made for mental health, which no receptionist. There's another issue with it. I couldn't remember what it was, but they don't take HIPAA into mind or whatever. And not whatever important, but they it's just not something that's thought of if you're not in the healthcare space. And so they had trouble. They had to deal with this site audit. And you never know when they're going to show up, and someone's supposed to be there to greet them, and then they figure out if you've got a decent office space or not. So I know that's one of the things that I've thought of more recently. What should a behavioral health professional look for? Like, if you're going to list 5 things or a few things, like what should that behavioral health professional be looking for in co-working or this shared space model? I know you mentioned a snack bar, but are there like other amenities or anything else they should be thinking of? That kind of stuff.
Yeah, I mean, besides keeping your staff or the therapists or professionals renting the space fed and able to do the work they want to do, you want a space that's purpose built for your field. You don't want to come into a cookie cutter place that someone from a law office and then an engineering office and then a healthcare office, they all come and use, because it's just not purpose built. And a lot of the things you want to find is, are these rooms soundproof, right? We want to make sure that confidentiality is maintained here, making sure that the whole infrastructure is HIPAA compliant. Everything from your waiting areas to your receptionist who understands confidentiality. And beyond those key aspects, we want to look at the vibe too, right? You want to feel that the environment is calm, it's supportive for you and your clients. So when they walk in, they want to feel like, hey, I'm going to be greeted professionally. I'm going to have a calm atmosphere to settle in before my provider pulls me into their room. And so even just having that snack bar, like you said, right? They can come in, have a little beverage, a snack before they see their provider. Just putting people at ease, making sure they feel comfortable where they're at.
Yeah, I suppose that's part of the whole experience of the whole therapy. For us, I guess we're always thinking in mental health therapy, but just that whole seeing a provider experiences. It's not just talking with the provider, but it's the moment you even walk up to the door and then through the door and everything that happens before that interaction.
Yeah, that's really important, I think, and the privacy too, and the respect that therapists need and do show, in the waiting area or whatever. It's like, we've stressed that in the years previously, and currently too, just about keeping things private, HIPAA compliant, and I don't know, respectful. I keep coming up with that, and a comfortable environment. So, yeah.
It sounds like you've given that a lot of thought, Talha.
Yeah. All right.
Yeah, I think just, having the background is really important. And so really creating a space with the understanding of what I know I would want in a space, and creating that, because therapists, psychiatrists, we do such similar work, and healthcare professionals in general as well, whether it's holistic care, we all want to support our patients and clients. And so creating an atmosphere that does that is really important for us.
Cool.
Yeah. Okay. Where are we at here, son?
Number 8.
Okay.
So we got our question list on the screen that we go through. You got to flip your pages since you
Oh,
the
yeah.
paper thing.
All Okay.
Let's see if we're gonna take a quick break. I might just pause this here real quick because our autofocus is effed up. So
Okay. Well, yeah. Okay. So we should wait for you.
I don't want to ruin the conversation.
All right.
Oh
my
I couldn't do it from
gosh. Well, and I'm trying to follow the screen up there. So.
Well, the technical aspects of, podcasts and a recording are, a lot to navigate, I'm sure.
Oh my gosh. I'm so glad I'm not doing it. So, well, and all this stuff, the past two I've been doing remotely, with my computer like you're doing, and it seems to work out okay. This is like, oh wow.
This just makes us look like we know what we're doing,
Okay,
right?
okay.
And then through the magic of video editing and audio editing.
and thankfully most people are just listening to these, not watching them.
Yeah, well, when you got faces for audio or radio like we do.
Oh yeah. Oh boy. Oh.
All right. How the hell do we get back into this?
Yeah. Okay.
Do you want me to put our names up on those? Because I took them off before. But do you want
what
me
this?
You've got your J and P and all that stuff on there?
Yeah, I did.
Otherwise, I got to follow your script, so I know what the heck I'm doing.
See.
So keep flipping that damn thing.
Okay, I'll keep flipping it. Okay. So.
All right.
So we're gonna go again.
So I think we're right here at number 8.
All right.
So we're gonna get into and Tyler, you got the script in front of you, right? You're looking at the same thing we are.
Yeah, I got it pulled up.
Cool.
Okay.
All right. Cool.
Great.
So on with number 8.
All right. On with number 8. Here we go.
All right.
So Talha, with Mindful Spaces, you've built something intentionally for mental health professionals. And I'm wondering what kinds of features or elements have been most impactful, that you notice with the folks who are coming in. And you've already alluded to that a little bit about, I think, creating that personal space. I mean, you took some real time to be thinking about that. So yeah, give us your pointers.
Yeah, I think for me, community is a key word here. It's why I prefer to call it not a co-working space, but a co-working and office shared community. Since it is a community, you get to meet so many other providers, and they may have specialties that you don't have, and it creates a referral base. And if you are full, you get to say, hey, I know James next door, or I know Andrea 2 doors down, she'll be here on Thursday, who has space. That community is what's really important, and being able to say, I know these people individually, I know the work they do.
Mm-hmm.
So when you're looking at a space, finding that community, creating that community is really important. And when you have a community like that, not only do your patients benefit, but so do you, because you have support of maybe more experienced business owners who can guide you along the way as you're learning. They can also provide you with referrals so you can grow your practice. And as many of you know, like during COVID times, it became really isolating working from home. And now people are coming back to seeing people in person. And so being able to mingle, feel less isolated. And in private practice, especially for a lot of people, they do feel isolated because a lot of them are individual solo providers. A lot of them don't have multiple providers in their space. And so this way you can feel less isolated, you can feel supported, and that professional community is what really makes that key difference, in my opinion. And that's why I love, where I worked in the Chicagoland area, and that's what we're creating here as well, just to have a community, if nothing else.
So, yeah, I really liked, that was interesting to hear. When we first started talking, I didn't realize that community aspect of what you were doing with Mindful Spaces. And especially when you were talking about a bit about it last night, it really just kind of triggered just how important that community is. And, how that's not necessarily like it's kind of a natural result of being in the same space as people, but it's not something that's done mindfully all the time, and definitely not in all the co-working spaces. But, you go into your co-working office with your Tuesday crew, great. You kind of know who's there on Tuesday, and that's about it. But to actually have a thoughtfully put together community where, it's more than just that necessarily sounds like a real benefit.
Yeah. Just to touch a little bit on how we create that community, the software that we use to run the co-working space is really important for that, because each member gets a login, and this is going to date me, but it kind of really looks like Facebook or MySpace, some of those older, online platforms where you as a member can post on a feed and you can say, hey, members of the co-working space, we're doing a happy hour this Friday, or somebody left their car running in the parking lot. It really creates this community because people can post and it's just for members of the co-working space. And within that, people can message each other directly. There's, a feed where people can post. They can even request, space, like I need to swap out a day. Can somebody please, swap with me? So being able to connect with all the members is really important. And so that software was a really big advantage for us when we found it and we created the space.
Huh, that's really cool. And another, I don't know, as as software vendors ourselves, it's always good to hear, when software can have a good solve for a problem or a good, improvement for the people who use it. I mean, that's the whole point of software. If it doesn't make life easier, why have it?
Right.
So between that, I mean, you've been keeping an eye on broader trends in behavioral health. What are you seeing right now? What challenges? And you talked a little bit about the private equity backed practices and kind of I always pick the picture like the conveyor belt in some of the old cartoons, like the old, the old, not Looney Tunes. I don't know what it was, the Porky Pig and the Gang, whatever that was. And just like, on each little line on the conveyor belt, here's another patient going through, run them through the machine. And then, whatever comes out doesn't necessarily really matter. They got to go through this machine and that's it. It's the same thing for everyone. So how do you see that affecting, what you're doing and, or the decisions you've made, with mindful spaces or just, general broader industry views?
Yeah, absolutely. I think for me, the biggest challenge was the loss of autonomy. And when decisions are being made to maximize profits rather than improve patient care, providers, patients are all at risk. And there's just a lot of pressure to see more people in less time. And providers end up being exhausted, burnt out, and undervalued. And that's what pushed me to start a private practice. And for me, I want to support other individuals who are looking to start private practice. I think we've touched on this on our random conversations, and even last night at the event, is that we are not each other's competition. We are actually a supportive community of private practices who help support each other so we can provide patients the care that they deserve. And with private equity and venture capitalist based, clinics, I've seen people tell me that, hey, a 30-minute appointment for medication check has now been reduced to 10 minutes for face-to-face contact and 5 minutes to do your notes. And I'm like, I can barely ask them how their weekend was in 10 minutes, and you want me to do a full evaluation on just medications in 10 minutes? That's not something I want to do.
Mm-hmm.
And that's a lot of the feedback I get from other clinicians as well, and patients who are like, hey, we really feel this is a breath of fresh air where you actually listen to me for half an hour, and your new intake was 60 to 90 minutes. And that independence allows me to provide the care that I want. And I think there's a lot of people who want to do that and provide good care. And I think that with a lot of these bigger companies, you take home less of the chunk of the pie as well. So it's not only the care, but also the financial aspect. So you can make a little bit more money in private practice as well if that's a motivating factor for you.
Hmm. Well, okay. So, and then as you're talking here, I'm going, okay, how can independent practitioners continue to thrive, in being independent, and it sounds like you found some of the keys to doing that, and making a decent living, that kind of thing, which we all have to do too. So, yeah, thoughts about that?
My biggest piece of advice for people is be intentional, know your value, and don't be afraid to create your own path. There's going to be a lot of hurdles along the way, but it's really important because you get to create something you're proud of, do something the way you want to do. And spaces like mindful spaces, were created to support that journey. We try to take away the barriers so that you can focus on your patients and your practice's growth without worrying about the overhead.
Okay. Similar values in here.
Yeah.
That the independence and just keeping the focus where it should be from my perspective too. It's like it's really important. And staying one of my mantras over the years has been staying out of people's way as an administrator, just let the therapist do what they want to do. So yeah.
So, what advice would you have for someone starting their first private practice? They're getting through here. We talked about the business aspect. We've talked about the the accounting aspect. We talked about the banking aspect. So, for someone starting their private practice, if they're trying to make smart decisions about their space, throw a few nuggets out there.
Well, I'd say definitely start small. Don't feel like you need a full-time office right away. Explore co-working spaces, explore subleases or other flexible models that give you the time to grow. And then surround yourself with people who've done it before. I think mentorship and community are really key for those aspects. And having people in your corner to root for you, even if they are not part of your practice, is still really helpful. And that's how we, thrive as a community of healthcare providers, and we provide the best care that we can. So don't feel like you have to do it all at once. Take it slow, grow, learn along the way.
Okay. I'm also thinking here about what how committed do I need to be if I were to come to mindful spaces and just want to start out, uh, what's the process?
Yeah, well, mindful spaces keeps a couple things in mind, right? We understand that you don't need a full-time space, and maybe you're someone who just needs 8 hours a month. That's our smallest package. You can buy that package and use that 8 hours throughout the entire month how you feel is beneficial for you. So you go on the website, you click on the half an hour portion that you need, and that's reserved for you. And even as you continue to grow, then you go up 8, 12 hours, 15 hours, 20 hours, 40 hours. It's there to help you grow when you're ready to. And having basic packages just for a virtual address and being part of a directory, that basic membership model, I think that is also a really good way for people who are just starting out. I think we touched on this yesterday at the networking event, is that having an address before anything else is just really important, because you want to know what address you're going to use for all your contracts, all your credentialing, all your marketing. So taking a look at a place like this, even if you're not ready to see patients yet, you have an address and you don't have to pay $800, $1,500, $2,000 for rent. You buy a few hours and you're good to go, and you're part of this membership now and you have an address. So it provides people an opportunity to get started without having to break the bank.
And um, and just out of curiosity for our listening audience here, how do you handle things like the mail that comes in? If they're using your address as the mailing address, or part of that virtual address, part of the package, what happens with that?
Yeah, so we have our full-time receptionist who collects the mail when it's brought in, and then we have an employees-only section where each individual practice who is a member has a mailbox slot, and we put the mail in there. And when they come in to collect their mail, our receptionist grabs it for them. It's not open to everybody, so people aren't going to be able to go and snoop around,
Mhm.
take your mail by accident. So we're keeping it really controlled in that manner. And with that software I told you about, it's really nifty, because if somebody says, hey, I was supposed to have a piece of important mail come in, I don't have the time to come into the office to pick it up, we can actually scan and upload their email in a HIPAA compliant manner to their profile, so they can then download it and see if it's something that they need to come in and pick up, or they can use the information for. Because oftentimes,
Mhm.
well, banks will send letters or Medicare will send letters, and you need to respond to it within 5 days. So if they aren't able to come in, we can scan it and upload it through the portal as well.
Yeah. Oh,
Cool.
getting that information from your banks and any of your payers, and reading those letters and responding is so important. So that any way you can grease the skids for that process, and
Mhm.
making sure that, in the credentialing world, we'll get like third notices and like, hey, your credentialing has to be renewed in by the end of the month, and it's like 3 days from the end of the month, just because folks haven't gotten to their mail, or they have an office in one town but they do a lot of virtual stuff. And so to have that sounds fantastic. I hate having to rush stuff for people, or there's just so much stress involved with that.
Right. And
Oh, absolutely.
yeah, getting kicked off the insurance is not a good thing.
No,
It's very
your clients
frustrating.
start getting letters.
Yeah, it's just it's only happened once to me.
Ah,
So,
I'll save that for another episode. All the mistakes I've made.
right.
Well, I want to touch on a mistake here, and this is about a mailbox actually. So I do maintain mailboxes in different states for that, for those reasons that we talked about. But you should always have important things then forwarded to your locality, because I hadn't realized certain checks were going to other mailboxes in another state. And by the time I received it, they're past the 60-day void mark, and now I'm requesting for a new check. So
Oh, yeah.
you have to stay on top of those things, and you have to redirect your mail to where you'll be collecting it more frequently as well.
Yeah. Yeah. On the billing side, we've had to go request those checks for people before, and it takes a while. The payment's delayed. It messes up finances. It's a pain in the butt for everybody.
For sure.
Yeah, yeah. Tracking a lot of that down, and especially if you're a solo practitioner and you're just growing, sometimes you just don't know how to go about it. So it's pretty daunting at times for sure.
Yeah.
Well, should we move on? What
Sure.
the heck,
What the heck? Yeah.
Myths or misconceptions in our field that you'd like to clear up.
A little myth busting.
Just
Oh man, you guys are reminding me of that. Was it National Geographic that had Mythbusters?
Oh, yeah, I don't remember that. That was totally popping through my head when I saw the headline on here. It wasn't. I don't think it was Nat Geo, but one of those stations. Yeah, I used to watch that all the time. Even my kids love the old episodes.
yeah.
Yeah, absolutely. I guess for me, the biggest thing I want to talk about is like the myth that you have to go big right away. And I think we touched on that, start small. Because a full office, a full staff, signage, the whole 9 yards, that's a lot. And it's not true that you need to start really big right away. You can absolutely build something meaningful and sustainable by starting lean, staying connected to your values, and being able to grow. I think will help you feel more comfortable in the direction you're going, because you're not playing catch up with all this money you put into your practice, and you'll feel more confident in what you're doing. And then the other myth I'd want to bust is that you don't have to do everything by yourself. And I learned that the hard way. I tried doing it all by myself, when really find that community, find the people who know how to do credentialing, how to do contracting, how to do billing, because they're the ones who do this day in, day out, and they will do it right. And if you're just learning and you're guessing, you're going to make a lot of mistakes along the way. And to touch on some of that is the big myth around private practice. And I hear this quite often from people who are leaving bigger organizations, is that, well, they take so much from each individual encounter. And if I go into private practice, I will keep all the money from that encounter to myself. And people believe that becoming a private practice owner, they're going to become instantly financially secure, or they're going to make significantly more money in private practice. And that's definitely not true either, because no one really thinks about the overhead when starting or when running a practice, right? We don't think about the receptionist. We don't think about the utilities and the Wi-Fi and everything else that goes into it. And you're like, oh, wow, that person who I was working for took care of all of that. And I just walked home with a check every day. Now I have to manage all of this. So that is one big thing people learn when they dive in, and they're like, I didn't realize that part was going to be really tough.
I think of that whenever I hear that too. When a provider is leaving, and it's like I get 100% of my whatever what my claim's paying out at, and it's those operational costs, that 15 to 20%. even to 25%, if you're running pretty efficiently, that you're giving that up. But, so I remind people too, cause we're percentage based, at least here in Minnesota and the other states, mostly other states, which allow that. We can do this percentage based billing. Is you got to look at all these percentages of what percentage of your revenue total is going towards just administration and operations. And so you got to remind people that what you're getting in return for that. So if you're making 80% working for a group or 100% working for yourself, you're still only making 80%, but you're in charge and you get to make the decisions about how your practice operates. And that's one of the beautiful parts about starting your own practice as well.
Absolutely. And at the end of the day, time is money as well. And so chasing after some of the denials and those claims and all those difficult things that come with that, if you have someone doing that for you, you can focus on seeing more patients and providing more care while somebody in the background does the rest of it for you. So there's a lot of things that should be divided out to people who know what they're doing. And that, takes away from your, overall net haul, if you want to say, right? You don't keep 100%, but it's really important to keep that in mind. Overhead is important and you want to keep track of all of that.
It's like, I'm hearing two things, where you should not spend a whole lot of money on, like getting a full-time lease and that kind of thing. And also where you should spend some money on, like credentialing and contracting with people, have a professional do that. I just wanted to ask you, any other thoughts about, what you want to prioritize with the limited funds that you have?
Absolutely. I think having a good accountant, having a good lawyer, and then having a good credentialing team. I think these three things to get everything working smoothly and making sure you're abiding by all the legal requirements is going to be the best money spent initially, because if you do something wrong, the amount of money you're going to spend down the line will be dramatic. And so if you can get your foundation strong, everything else will fall together. I mean, at the end of the day, your office, your furniture, your marketing, that's all the fluff on the cake. But the real matter inside is the platform that you build, and you want to have everything legit, and you want to make sure all your contracts are good, making sure your rates are good, making sure that your organizational structure is correct. All of those things I think is really important, and people don't often understand that, and they kind of do a lot themselves and then later are trying to figure out, should I be an S Corp? Should I be a C Corp? Should I be a solo provider? What's a type 2 NPI? What's a type 1? So a lot of things they start learning later. And I think that's all really important to figure out beforehand.
Okay. Yeah. So I'm hearing accountant, lawyer, credentialing team, for sure.
I'm going to throw billing in there too, just because just for that, because they help maximize your revenue too. And make sure you're getting all the codes in and getting paid everything you should be. But I'm a little close to that one.
Maybe. Oh
no, absolutely. And the reason I didn't say billing is that comes once you start seeing patients. But before you even get there, you need some of the other stuff. But but absolutely.
Having a lawyer look at your intake documents, I'm thinking, and just making sure that, the authorizations and everything are legal, and so, yeah.
Absolutely. And I mean, all the little things, right? Like,
so,
like I believe like Medicare, Medicaid rules are different than private insurance rules, knowing who you can charge a late cancellation or a no-show fee for.
Yes.
And who you can't charge that with. All these little things, people don't often read the contracts. They just sign like we do when we download an app on our phone and we just click yes and accept. So we really need someone to review it and tell us what we're doing.
Yeah. Well, and even calling the payers too. And I think we talked about this a bit on our last episode. I know it came up last night at the networking event, is calling payers to get an answer. You got to call them 3 times and you're going to get 3 different answers sometimes, depending on what the issue is. So they don't always know, so they can't even help you stay compliant. So it's hard. And you want someone who understands healthcare to be supporting you.
Yeah.
Absolutely. And a lot of time what you're on the phone on hold for 30, 40 minutes. I mean, that's time you could be seeing clients. And so if you have a really busy day, you get done. Now these insurance offices are closed after 4:30.
Hmm.
When do you actually have a moment to call yourself and stay on hold? So professionals who do this day in, day out have connections with those insurance companies. They have certain people they reach out to. So let them do what they do best.
Yeah. Yeah. Good points. Oh, well, I'm wondering anything else about the networking event that you held and, uh, anything you want to tell us more about that?
Yeah, I mean, this is one of many future networking events that we're going to be hosting. I do appreciate Paul being there yesterday. He talked on contracting, credentialing a bit, and also on medical record softwares, and it was very well accepted by the folks who came by for it, and they really appreciated the information and insight he shared. Our goal is to do something similar to what this podcast is doing, is really helping private practices grow, and that's from the ground up. And so these networking events, we're aiming towards people who are looking to start a practice, looking to grow a practice, and just to network, because you want to build that community. Whether you're a member of Mindful Spaces or not, we want folks to come, because the more people who come to these, that grows my referral base, that grows the therapist referral base, and we just get to know more and more people and provide better care to folks.
So, if someone's interested in a tour or wants to connect with you, Tala, either to learn more about mindful spaces or refer to your clinical practice, what are a few ways that they should reach out?
Yeah, so I'd say the best way is going to the Mindful Spaces website, which is www.mindfulspacesmn.com.
Mhm.
And you can request a tour directly there. You can see pictures of the space and some videos as well. And we'll coordinate a tour date and time when people are interested. And we've been giving multiple tours a week, so there's been a lot of interest, and we're excited to continue the growth of Mindful Spaces. And if things continue as they are, hopefully we'll have a second location soon. I think people are really excited for what it offers and gives them a big chance at growing something and being flexible. So we're really excited about that. And then for clinical care, if people are looking for a psychiatrist to refer to in either of those four states you mentioned, California, Illinois, Minnesota, and Ohio, www.comprehensivepsychsolutions.com. They can schedule a 10-minute brief introductory call right there on the website.
Mhm.
So I like to do this introductory call, one, to understand what each patient's needs are and make sure that I can appropriately provide the care before doing an hour, 90-minute intake and saying, hey, that's just not my specialty. And then saying, I'm sorry, I still have to bill you for this time. So that brief 10-minute conversation, I can make sure that they're appropriate for the care that I can provide. And then making sure that if it's telehealth, that I can address those concerns safely. And if not, I refer them to an in-person psychiatrist. And we are able to usually get people in within the first week after that call. With that in-person office in Eden Prairie as well. We're growing there. We're having more and more in-person visits going on. So it's really a good time for growth for us, and we're really excited for the direction both businesses are heading.
That's
Fantastic.
great.
That's
Yeah.
awesome.
Yeah, for sure.
So, before we go, we always like to ask, what is something you've been thinking about lately? It can be related to work, life, anything at all. So, Tala, what you been thinking about lately?
Well, I don't want to be a downer, but I think as healthcare professionals, as mental health care professionals, we have a big say in what happens in the world around us. And with the political climate, with people being really afraid of, how they're being perceived in the community, and they often share their concerns with their therapists, with their healthcare workers, we can be a voice to advocate for our patients. We should be on the front lines of any sort of um, catastrophe going on across the world or the way people are being treated locally. Our voices are really important, and we want to advocate for a community that is accepting of all individuals. And so taking advantage of the positions that we hold in our communities, because not only are we healthcare and mental health care providers, we're also leaders in our own right and professionals and politicians, they do listen to what we have to say. So being a big advocate and advocating for our patients and our clients is really important. And then on a more exciting note, my wife and I are expecting our first child. So, that goes into the idea of being in a world that we're happy to bring a child into and advocating for that world. So everything going on, we're excited, we're humbled at the same time. And, we're just hoping to create a community where everyone gets along and we bring, children into a world that offers the same for them.
Awesome.
Yeah.
Amen.
Yeah, for sure. Oh, I just got back from spending some time with my granddaughter in Chicago. And she's 18, 19 months now. And it's,
Wow.
the hopes and dreams for her for the future and bringing them into a positive world.
Yeah.
For sure. Appreciate that. So.
Absolutely. And I forgot you guys have some family in Chicago. So, definitely, we chatted a lot about the food and everything, and I'm excited to kind of head to Chicago here, have some Chicago pizza and have some Chicago style hot dogs here, hopefully in the next few weeks as well before baby comes.
Oh yeah. No ketchup.
Yeah, no ketchup. Exactly. Some sport peppers, and we're good to go.
A foodie. He's born and raised Chicagoan. And so he makes sure we get all the good food and that we eat it the right way too.
Well, you got to ask him what his favorite Chicago style pizza is, because that's an ongoing debate.
What is it?
And whether it's a pizza or is it?
What was that?
Well, the thin crust, is that, would we say New York style? Chicago has more of the stuff.
New York.
Deep dish.
I know, but
deep dish. That's what we're talking about.
The deep dish.
Here.
Okay.
Chicago pizza.
Yeah. Okay. But he gets some really good thin crust pizza too.
He did. Yeah. What's the name of that deep dish place that he loves? That we've been there like 2 or 3 times.
Yeah, we always go.
Yeah,
Giordano's.
We have to have like the foodie episode too.
Oh,
we can do anything with this podcast.
Yeah. And I mean, depending on who you ask, right? Some people don't even consider Chicago pizza. They're like, that's actually a casserole. So don't say that to a Chicagoan, they'll get offended. But I mean, between Giordano's, Lou Malnati's, Geno's, there's so many good options. So.
Yeah, Giordano's. I wonder if that's
the one. Oh man.
Well, and Malort.
Oh gosh.
Yeah, we've learned what Malort is. For the audience, Google it, look up the descriptions.
Yeah, it's. I'm thinking grapefruit and diesel fuel. That's the best I can get.
With dandelions and baby diapers.
Oh, there. Okay.
All that.
No, we don't talk about it.
That sounds wise. Oh, wow. Well, Talha, thank you so much for joining us today.
Yeah.
This has been great.
Well,
absolutely.
We're jumping ahead. What are you thinking about, Dad?
Oh, what am I thinking?
We've got thoughts too.
Oh,
we're talking about pizza. It's just all gone. Yeah.
Okay. Well, my thought is I'm kind of cleaning house. I've got destroying records, and keeping up with that. I've been doing that lately because we go back to paper records, and I look at these paper records and I go, oh my gosh, this is absolutely amazing compared to what we do now with electronic health records. But
it's changed in 7 to 9 years.
Yeah. So we're cleaning house that way. I've been thinking about doing that.
Okay. All right. Well, and
what about you?
Well, and I've been thinking about time, like the experience of time.
Oh.
Just had this weird, and it was just I was having lunch with somebody yesterday. Who was talking about, his 2-year-old daughter and his 4-year-old daughter, and how the 4-year-old, he's just been playing with her. He's going to clean out the dishwasher, and she wants to play with him, and he's like, well, I got to finish this first, but then we can play. And she's like, no, I want to play right now, because a child's perception of time, and so that triggered this whole thought about a child's perception of time is so different. It's like we were playing, then there's this thing, but there's a space, and then I want to play now, and now is all I've got, and so I want to do this thing right now, and so waiting is so painful versus you get to be old and curmudgeonly like I am, and you're even more so. and and how, like, I'm thinking ahead to 2026, and I'm thinking ahead, like all these years. So it's kind of like, as a kid, summer vacation was 3 months and it was like forever long. And now I'm already through summer vacation in my head. I'm planning fall and next year too. And just how different that changes as you I think as you age, the time changes. But then also, just as you need to think more about the future and really plan for that, it also changes that way too. So that was like the weird deep thought.
That's deep.
I know. Yeah. Next
Oh,
time I'm just gonna
That's
think about
okay.
I don't know, why does cereal float on top of milk in some cases and why does I don't know. I'll go with something totally mindless. But yeah, time.
It's a quick answer. It's just surface tension. You don't have to think too hard about it.
Okay. Good. Okay.
That's great.
And I don't have to have that thought. Thank you.
Oh. You're free of that thought. All right. Anything
No,
else
absolutely.
about
Speaking
that
of time,
offer here?
Yeah. Well, we've covered cereal surface tension, covered time.
Yeah, well, again, thank you very, very much for joining us today.
yeah,
You're doing some really important work, and with a wonderful mindset from my perspective,
Mhm.
and just keep it up. This is great.
So yeah, for those listening
Absolutely.
or watching, we'll drop links to Comprehensive Psych Solutions and Mindful Spaces in the show notes. So go check out those two websites, and definitely take a tour of Mindful Spaces. It really is a really cool space. I really love what you guys did with that. Yeah, so check out those show notes. Check out those sites for Talha here.
All right. Well, so that wraps up part of
Appreciate
our
that.
series on the private practice space. And in an upcoming episode, what are we going to do? We're going to shift gears and talk about traditional leases, subletting, and commercial real estate pitfalls to avoid.
Spoiler alert, one of those pitfalls is signing a lease without reading it. Just read it and just take the time to comprehend it. The other is thinking triple net refers to how many clients you'll get from a marketing funnel.
Oh my gosh. If it was only that simple.
So that's it for this episode of The Right Tack. Make sure to follow us on wherever you get your podcasts at, or even on YouTube. And you can actually watch us too, which I'm sure is going to be a lot of fun. And if you like what you're hearing, share it with your friends, your colleagues, get the word out. But until next time, I'm Paul Jonas.
And I'm Jim Jonas.
Keep your eyes on the horizon.